What role do you think exercise plays in longevity?
I guess you could argue that once you understand the kind of basic principles of a healthy diet, then you should be turning most, if not all, of your attention towards setting up an exercise regime across the week that targets different types of systems. So making sure that you have exercise that's working your cardiovascular system, and increasing your VO2 max, for example, which is a kind of a typical measurement of cardiorespiratory fitness. We know that, people who have higher VO2 max, Doug, depends on the study that you look at. But if you look at someone who has low cardiorespiratory fitness versus someone who has high, and you're going to get cardiorespiratory fitness through, it could be moderate kind of intensity, continuous training. Like imagine sitting on a bike, a steady state, going for 45 minutes or an hour, or going for a slow jog. You will get some improvement in your VO2 max from that type of training, and you'll get improvements, arguably better bang for your buck for VO2 max from high intensity kind of interval type training. You'll get improvements from both of those, but people that are regularly doing that on a weekly basis and have higher VO2 max, their risk reduction for mortality over a kind of, which means premature death or death during, say, a 5 or 10-year period, depending on the study you're looking at, can be 4 to 5 times less risk for that group that are really, really fit, have high cardiorespiratory fitness compared to someone who has a much lower cardiorespiratory fitness level. And that is a risk reduction that's much, much bigger than you would see in nutrition. Depending on the study, it's actually bigger than smoking and not smoking. It's bigger than alcohol consumption. So I guess just to kind of compare some of these different aspects of our lifestyle in terms of how powerful they are at reducing our risk of cardiovascular disease and premature death, exercise is right up there. And here's the great thing, something that I think is incredible, is that a large portion of that risk reduction is actually achieved from going from doing basically nothing or very little to just doing a little bit. So again, we probably don't have to overcomplicate it. If everyone could commit to a kind of minimum level and, for example, Doug, just doing a 4-minute high intensity interval, which is basically taking your body to say 90% of your heart rate max for 4 minutes. Okay. And if you were able to do that 3 times a week, okay, 4 minutes, say on Monday, 4 minutes on, say, Thursday, and 4 minutes on Saturday, right? There are studies showing over an 8 to 10 week period, you can improve your VO2 max by about 10%. Now, in that same study, actually doing 3 4-minute intervals, so 3 times the dose across those 3 days, yes, it improved VO2 max a little bit more, but it was only a couple of percent. So just doing 4 minutes of this high intensity interval training 3 times a week led to a 10% improvement in VO2 max. And based on epidemiological studies, Doug, that could be 20-30% reduction in risk of cardiovascular disease. We're talking 12 minutes of exercise over the week plus a warm-up. And of course, I'd love people to do more than that, but I'm kind of just trying to illustrate that a very small dose can have such a huge effect. And these effects are peripheral in the muscle, but also are central. So your stroke volume, your heart rate, cardiac output. And I'm not sure how much more detail you kind of want to go into. I'll throw over to Layne. We could get a lot more detailed in terms of prescriptions. But yes, exercise is hugely important. It doesn't get enough airtime, and it's well worth us spending more time focusing on.
100%. So, did my PhD in nutrition. I love nutrition. And as I said on Joe Rogan's podcast 4 years ago, people spend so much time in the minutia of nutrition and don't even exercise, which is like stepping over dollars to pick up pennies. It really is. And especially when you consider the lifestyle modification needed to incorporate kind of good nutrition compared to what most people's normal nutrition is in a Western diet. As Simon just said, like 12 minutes a week, 12 minutes. There's so many different charts, like looking at various aspects of exercise and mortality, and the inflection points are so ridiculously striking. You look at grip strength, like grip strength after age 65 is incredibly tightly correlated to mortality. Inversely correlated to mortality. So is lean body mass. Not only that, it's inversely associated with the likelihood of becoming disabled. And not only will you reduce your risk of mortality, you will drastically increase your quality of life, right? A lot of people talk about longevity, but I don't think many people are interested in living to age 80 if 15 years of that is confined to a wheelchair and in an assisted living facility, right? I think everybody's ideal sort of longevity is, okay, live into my 80s, and even, when things start to break down and maybe, I get close to death, I'm still mobile and having a high quality of life for the vast majority of that, except for maybe the very end. In fact, I think about my grandfather who died at age 84. He had his first heart attack at age 52. And this is back in the 70s when open heart surgery was like, carpentry. Now it's an outpatient, sort of thing. And literally, he has a scar from like his upper chest to his lower chest where they broke his sternum, cracked his ribs open, and did heart surgery, right? And I think his life expectancy was something like 5 years after that was the average life expectancy at the time. And he made a lot of lifestyle modifications. He did the dreaded low-fat diet and reduced his saturated fat and, started exercising in terms of like walking and he just walked was pretty much his exercise. And he was fortunate enough to live till 84. And I remembered it was the first time I ever had thought about like dying. He died in his home, lucid for the vast majority of it, talking to his family. And then when he passed, it was very peaceful. And I remember thinking, man, if I could go like that, like what would that be worth, compared to the way a lot of people unfortunately go, which is with much less dignity, right? And I think a lot of it was the lifestyle modifications he made and the exercise he did. But if you just look at a graph of steps versus mortality, there is a huge drop off in the risk of mortality just going from 2,000 to 8,000 steps a day. To get 8,000 steps a day, if you were completely sedentary and did almost nothing, if you just did an hour walk per day, you'd probably get to 8,000, okay? Now that might sound like a lot. Most people aren't that sedentary. Like I would not consider myself a super active person other than my resistance training that I do. But I get about 8,000 steps a day without even really trying. And that's mostly just because I'm like pacing around while I'm resistance training. But for most people, even with a sedentary job, you're going to get 3,000 or 4,000 steps per day, just doing your basic human stuff. So you're talking about adding a 30-minute walk every day. Like listen to a podcast, or heck, put on a Netflix show and go walk. Or don't even go anywhere and walk. Just get like a little treadmill in your bedroom or your living room or wherever you want it. Watch TV and walk. You can do it. So just doing that, sharp drop off. And then it continues to drop off to a lesser extent as you go even up to like 20,000 steps a day. Same thing with grip strength. Same thing with lean mass. Same thing with VO2 max, like Simon just said. So I think the problem is a lot of people have looked at fitness people like myself or people with six-pack abs or whatever, and they look at what they do and they go, well, I could never do it like that, and I'll never look like that, so I can't be fit. You don't have to. You really don't. In fact, to get that lean is probably actually not conducive for health, to be quite honest. If you've got a shredded six-pack, and as somebody who's had a shredded six-pack, you don't feel very good when you have that. And I would say your quality of life is probably pretty crappy as well. Just remember, for anybody out there who feels less than because you don't have a shredded six-pack, most of those people are food obsessed, have disordered eating patterns, and have zero sex drive and very low energy. So just feel a little bit better about yourself. But you don't need to be like that. You don't need to be exercise obsessed. In fact, a lot of these curves are J-shaped with mortality, where when you get to like really high levels of exercise, you actually see like the risk kind of start to go back up. Now, I'm not ready to say that the exercise is somehow independently increasing risk. There could be some other lifestyle factors that are tied to that. Like people at that level of exercise are usually probably pretty extreme personalities. So I think there could be some other lifestyle and stress things that are going on there. But to just get like that benefit, just do 3 days a week of 30 minutes of something, even if it's just walking. And then I would say I'm a big advocate for resistance training, because not only do you get some of those VO2 max benefits if you're lifting hard, you get the benefits of muscle mass, and not just muscle mass, but also quality, which is huge. If there's a really popular image out there of an MRI scan, or maybe it's an ultrasound, of a 70-year-old sedentary person's quadricep, and then an Ironman, somebody who does Ironmans at age 70's quadricep, and the difference in muscle quality is absolutely striking. I mean, it's really impressive. So you're getting you're getting a lot of the benefits of cardiovascular, and you're also getting benefits in muscle mass and bone mineral density. That's another thing that people really overlook. Like people worry about calcium and vitamin D. Resistance training is literally the biggest lever you can pull with bone mineral density. When I went in at age 20, I got a DEXA scan for body composition, but they also measure bone mineral density. And I was almost off the chart in terms of bone mineral density. So again, it's just such a low-hanging fruit to go from sedentary to doing something like Simon said. And then if you can add a little bit of resistance training on top of that, and people are like, well, I don't know if I could do squats. And don't do machines, but just, do it to where it's hard. And you're going to get amazing results, to be honest.
No, I would totally agree that if you're going to dedicate some time to a program, try and have something that's working that cardiovascular system. And look, there's got all these types of studies about high intensity versus moderate intensity. And the reality is you're going to get benefit from either. Find the one that you're going to do most often. Let's say, for example, you get pain on a treadmill or going for a run. Well, you might be better suited to cycling and to take the weight bearing out of that. Now, arguably, the running could be better for your bone density, but if you're still doing some resistance training on the side as well, then you can use that to help improve your strength, maintain your strength, work on bone mineral density, and that it becomes really, really important as we age, because if you fall and you have a hip fracture, the risk of mortality in the 12 months following that hip fracture, off the top of my head, I think if you're over the age of 70, Doug, if you have a hip fracture, it's like 40 or 50% of people are dead within the next year or something. It's crazy high. So if we're talking about longevity here, then really setting up an exercise program as early as possible to prevent a fall by being stronger and having better stability, and also by building strong bones to reduce our chance of having a fracture if we do fall, which may occur, is going to go a really, really long way to reducing our risk of either A, having our quality of life significantly affected, or in fact, dying prematurely because we find ourselves in a hospital lying down, bedridden. And when you're lying down for 2-3 weeks not moving, you can lose a lot of muscle and you can slow down really quickly. So just another kind of a real reason to try and be proactive here and add a good exercise program in as early as possible.
Now, when you get above age 65, you start to see a shift in like the number, like cardiovascular disease, cancer are still the number 1 and 2 killers, but you can also tie a significant portion of deaths back to low muscle mass for the reason that's like Simon just said. If you're over age 65 and you fall and you break a hip or a bone or something like that, first off, the chances of you walking again, if you weren't active before that, are very low. And the chances that you'll get some kind of infection or some comorbidity associated with this fall is very, very high. So again, and the other thing I'll add is people say, well, I've never exercised before. I'm 70 years old. What's the point in starting? No, now is the best time. Now is the best time. because so I was at University of Illinois and I was in the nutritional sciences division, but right across the street at Freer Hall was their exercise physiology division. And they were starting a study when I was starting my PhD there where they were taking frail elderly who basically could barely stand up, and they were having them like progressively overload. But the way they were doing it was like they would start with like a really high box squat, right? So they barely like bend their knees and then come back up. And then gradually they'd lower the box. And this was over, I think the course, I believe it was 12 weeks, it might have been 16. By the end of the study, not only had they significantly increased their lean mass, their bone density, but some of them were almost able to do a full squat. And some of them were actually using weights to sit down to a box. Like, again, so you can build significant lean mass even in your older years, and it will absolutely benefit you. So don't let age be a deterrent to starting, because it will still make a major benefit for you.
Mm. And don't be scared of having a protein shake. I know, for example, my mum, I suggested to her that she added a protein shake in because I had a look at her overall diet and her appetite has gone down a little bit. And Layne sort of mentioned earlier, it can be harder to get adequate protein in or optimal protein in as someone gets sort of over 65 years old. But she'd come across all this stuff on the internet and she was worried about the protein powder. And of course, I reassured her, and she's been, happy ever since I had that discussion with her. But I just want to emphasize for someone out there who's doing the exercise, thinking about their diet, and is like, well, is adding a protein powder going to be a problem? No. In fact, it can be a very convenient, nice, easy way to help you achieve an optimal protein intake.
Yeah, and this is where we got to be very careful with the messaging, right? Like a lot of people are very anti-artificial anything, like get it from Whole Foods. Whole Foods is always better. I mean, yeah, if you can get it from Whole Foods, great, but getting it from a protein powder is better than not getting enough protein at all. So let's just like keep in mind where this messaging should be. And I think that's like one of the things I appreciate about Simon, and probably I would think one of the things he appreciates about me is whenever we talk about data, we try to wrap it in the proper context, because we've just seen how many people can create weird associations based on messages that are well intentioned, but possibly not painting the entire picture.